A caregiver is somebody who can provide reasonable care to a person in need of care. Everybody is a caregiver.
Yes.
But we have got primary caregivers and secondary caregiver.
Who are the primary
The
and the
primary
secondary?
caregiver is anybody, a neighbor, a relative, a friend, a passerby, can be a caregiver. A wife. Everybody is a caregiver. But now a secondary caregiver is somebody who has undergone training to become a real caregiver. Now, there are schools which provide training services.
In Uganda, do you have those services?
Definitely. In Uganda, we have many schools which are providing care training to caregivers.
How long is the duration?
We have an approved curriculum, approved by the DIT, Directorate of Industrial Training, approved to train the caregivers so that those caregivers can provide reasonable care to the older persons.
That's
How
excellent.
long is the duration? As per the Directorate of Industrial Training, the training depends on a modular system.
Okay.
How many modules have you covered? What expert? Do you have the skills of really? If you can exhibit the skills, but the duration can be for 2 years, for 6 months.
Okay.
Then you train and you become a reasonable caregiver. You have asked me, do we have schools? Yes.
Okay.
In Uganda, there are schools. But as people working in the profession of caregiving, we have merged all the schools together, those which are providing care services, those who are training caregivers.
We can have a look on our elderly persons. Thank you so much, Brian.
Yes.
As you explain about the caregiving, you can maybe say that's the elderly person and this looks to be a caregiver.
I can give a list of schools which are providing training to caregivers. We have got TIC, bedside and nursing services.
Mr. Nyanzi, we shall not talk about the list of the caregiving institutions.
Yes.
But rather, we can now go back to the real caregiving.
Yes.
Maybe since you've told us that the course is available, how long is the course?
Yes.
We can now dive into why caregiving is very important.
Caregiving is very important to the society. So that one point, it decongest the hospitals.
Okay.
Caregiving decongest the hospitals in that if take an example of an older person who is suffering from prostate cancer, who has got diabetes, an older person who has got Alzheimer's dementia, that older person cannot be kept in a hospital for so many days and so many years. That means you will be spending a lot of money providing care to that older person.
Transport to and fro.
Transport to and fro. If he's admitted in a hospital, the hospital bills. Now that means if you have got a professional health care worker who can provide good care services to the older person, you can remove that person from the hospital, bring him to the home, and he gets that services. Much as it has decongested the hospital, you have reduced on the expenses.
Yes, moving up and down, just
moving
like you said,
up
they're helping
and down.
heart rate.
Yes. And also, caregivers promotes longevity. What do we mean by longevity? An older person who would have lived for 80 years can add on another year. Can add on another year because he's getting reasonable professional care.
Perfect.
Yes.
Now, do the caregivers replace the bedside nurses?
Well, the bedside nurses, as per the curriculum of Uganda, the bedside nurses were nursing assistants, assisting the nurses. But as I've told you from time immemorial, we have been caregivers.
Okay.
Providing care from our homes. Now the caregivers are not nurses.
Okay.
They are typically caregivers because an older person will need somebody to feed, to provide the activities of daily living like bathing, feeding, exercise, and toileting. Now a caregiver will perform those duties, but under the instruction of a medical officer.
Okay.
The caregiver can take the vitals, check on the pressure, check on pulse, check on temperature, check on the sugar level. But after checking, he has to report to a medical personnel for instruction. A caregiver can provide companionship. The most important part of
we saw how she was being kept on the TV
is to provide
read the newspapers.
To provide companionship. Most of the people at home, they can give an older person food, and it says, Mama aliwa nti jaja twamuwadde mmere ali eyo. Next day they send Thomas or John, jaja mutwalire mmere. After 3 days, you find a line of plates. A year yesterday, neyoolwaleero nga zonna zirya. But a caregiver is somebody who will be there to make sure that this older person eats.
Exactly.
Emmere agiridde mbudde, agimazeewo quantity ki. Omukadde atambuddemu yeeyagadde. That is a role of a caregiver. Caregiver does not inject. Caregiver administer drugs. Empeke 2 omulundi gumu. Kumakya every after 8 hours. Ng'amanya nti ku ssaawa emu namuwadde, nziramu ne muwa ku ssaawa 9. Ate era nenziramu ne muwa. Kakati gwe omulimu gwa caregiver.
So the caregivers do not really inject the patients?
They don't inject the patients. That is the work of a nurse.
Okay.
But a caregiver can dress the minor wounds, not the deeper wounds, under the instruction of a medical personnel. But you just imagine, omukadde alina ebbwa lya kookolo. Buli kaseera neetaaga nansi bw'anajjawo.
Maybe erya diabetes.
Yes. Kakati caregiver has got the information on diabetes, on what. Alabirira atya ebigere omukadde akatya. Dugwe omulimu gwa caregiver.
Excellent. Thank you so much for you've taught us new information, and I know our viewers have a lot of questions for you here live on Google Data Vision, and I want to take the expertise of Mr. Nyans Frederick from the Aged Family so serious, because now caregiving has become a norm. And if I may ask, how many caregivers have trained according to your perspective, maybe according to the enrollment that you may know?
We have come up with an alliance okufuna data. But caregiver be mu training, trainees bameka. But roughly we started the training by the year 2020. 2020.
Just like 3 years back.
After the COVID, we trained caregivers. But as I can't give the data analysis of all the caregivers trained in Uganda. But already there is a need of caregiver, and they have seen the role of caregiver, and the public is realizing the impact of caregiver. More especially, there is a disease which is called Alzheimer's dementia.
We are going to talk about the diseases.
Definitely.
Now, I want to inspire viewers to use our social media platforms very well, and also get your phone ready so that you can ask the questions anytime when I start inviting you for questions. But now, you take us through the diseases that are most commonly affected, that often affect the elderly person.
Yes.
You are interested a lot in Alzheimer's disease, because I guess most of the patients I've seen around here, Kampala, maybe have the same condition. Could you please give us a highlight? Yeah.
Alzheimer is a mental disorder. A person suffering from Alzheimer's dementia can forget because he has got memory loss. It is a gradual impairment and non-reversible. You cannot reverse somebody who has got Alzheimer's dementia. Now that person, it is a matter of understanding which problem is he facing.
Okay.
He is facing an Alzheimer's dementia.